Hello, my name is Stacy Diaz, and today I'll be going over spinal cord injury quadriplegia. So, what is spinal cord injury or SCI quadriplegia? It is a pattern of paralysis that can affect someone from the neck down. It can affect someone's ability to move parts of their body as well as automatic processes that keep them alive. It's also known as tetraplegia, and it is the most common symptom of traumatic spinal cord injury. Some basic signs and symptoms include the numbness or loss of feeling in the body, especially in your arms and legs, the complete paralysis of arms, legs, and major muscles in the torso, chronic pain, difficulty breathing with some individuals with SCI quadriplegia requiring assisted breathing devices, trouble sitting upright. This would be due to the inability to balance, and then lack of muscle control. So there are two types of quadriplegia. There's complete and incomplete quadriplegia. For complete quadriplegia, all signals are blocked from getting through. The person loses complete muscle control and ability to feel sensations, and the brain can't manage any automatic processes that rely on brain signaling to work. For incomplete quadriplegia, some signals are crossed from getting through. The individual may still have the ability to move, feel sensation, or feel automatic processes such as bowel and bladder function. And these individuals have a higher likelihood of making a full recovery. So, some causes and risk factors. Cause number one is traumatic injuries to the spinal cord. This would include car accidents, motorcycle accidents, falls, gunshot wounds, etc. And then we have spine tumors or cancer. According to the Cleveland Clinic, this can include cancer that develops elsewhere in your body and spreads to your spine. And then we have lack of blood flow or ischemia. This would be due to a blocked blood vessel or a blood vessel rupture. And then injuries during birth or early childhood. Some risk factors include gender, with males being more likely to become injured. According to the 2019 NSCISC report provided to me by the website Spinal Cord, 27,453 men suffered from a spinal cord injury, while only 6,672 women suffered from one during the same time period. And then we have age, with ages 16 up in men being naturally more at risk due to older age. And then we have risky behaviors and career choices. This includes laborious jobs. Moving on to prognosis. So, according to spinalcord.com, depending on the cause, some people with incomplete quadriplegia may see improvement in their ability to control their limbs with certain quadriplegia therapies and exercises. However, others may see their incomplete quadriplegia progress into complete quadriplegia as their condition progresses. So, after reading this article, I kind of came to the conclusion that it is very dependent on the individual. Experts can't really say whether or not someone is going to worsen or better over time. It just depends on the situation and the individual. So, how common is quadriplegia? Like I said earlier, it is the most common symptom of traumatic spinal cord injuries. It happens in 60% of cases, with incomplete quadriplegia being almost half of those, and complete quadriplegia being 13%. It is more common in men with the ratio of 4 to 1, and the ages 16 and 30 have a are were likely in the statistics due to risky behaviors, and then adults over the age of 60 were more likely when it came to things like falls or accidents. And then we have barriers and accommodations. So I came up with two barriers. The first one being lack of wheelchair accessible doorways, and then curbs or lack of ramps. Um, so accommodations for these would include putting in that button for easier door access, the button that allows individuals who are wheelchair bound to press it and have the door automatically open for them. And then more ramps or just cutting down on some of those curbs that are very annoying and no one really needs. And then we have more awareness, which isn't really an accommodation, more of like a solution. I think the lack of awareness when it comes to uh, accessible doorways is insane. I think it's a bare minimum requirement that all establishments should have. So I think spreading more awareness is super important, more of a solution, not really an accommodation, like I said. Moving on to community resources. So of course, I had to include the well. It is valuable for individuals with incomplete quadriplegia, I would say, just because with the adaptive sports that the well has, you do need to have some sort of function of your arms. Um, so the well has wheelchair sports like basketball, tennis, and rugby. And I think it's a great resource for Sac State students because it would allow them, students that are wheelchair bound, to connect with other individuals like them or that are not wheelchair bound either. It's just a great socializing place for individuals who may feel a little bit shyer or may feel like it's a little bit harder for them to make friends. And then we have spinalcord.com. This website provides you with an interactive support group map, and it provides you with the names of those support group maps and their areas. For example, Rolling Inspiration in San Antonio, Texas. So, moving on to facts, complete quadriplegia individuals often cannot control their bladder and bowel movement. Some individuals, like Annie Kindegal on TikTok, don't have the ability to regulate their temperature. And according to Facing Disability, less than 1% of people with spinal cord injuries make a complete neurological recovery by the time of a hospital dispatch. This includes those with spinal cord injury, quadriplegia. And then most quadriplegics have perfectly healthy arms and legs. It's just their spinal cord or brain that doesn't allow them to move them properly or at all. And then so according to spinalcord.com, they may have a shorter life expectancy. People with quadriplegia, there could be, for example, a 15-year-old without quadriplegia that has an average life expectancy of 64 more years, while a 15-year-old with it would typically have a life expectancy of only 38 more years. And then here are my sources. We have Understanding Spinal Cord Injury. I love this source because it included 3 videos on medical experts' opinions on STIs and 3 videos of people who have been medically diagnosed with STIs. Some of them being with quadriplegia, and then what everyone should know about quadriplegia and tetraplegia. I really like this article because it was medically reviewed by a well-known medical expert named Dr. Dana Clark Curiacose. And then we have quadriplegia, and this article was written by a well-known Cleveland clinic. And then lastly, we have Annie Kindegal, who is an individual that has been medically diagnosed with complete quadriplegia on TikTok. So, when it comes to the connection between learning about this disability and how it can connect to my personal life or future career, I didn't really feel the need to bullet point this, so I will just say it. As a first-gen student coming from an immigrant household, I often feel it is my duty to learn as much as possible from the college system and relay that information back to my family. Knowing what I know now about spinal cord injury and quadriplegia, I can help my family make safer and healthier choices to avoid this happening to them and myself in the future. And if by any chance someone in my family becomes affected by this, I know a little more about how I can help them. When it comes to my future career, as someone who wants to open my very own boutique inn, I think knowing this information is important because it will allow me to be more considerate of those who are wheelchair bound and provide appropriate accommodations for them when designing my inn to make sure everyone feels like they belong. Thank you so much for listening to my presentation.